Good afternoon. I'm here to provide you a consumer COVID-19 update. Hopefully this information will prove to be useful for you in helping to protect yourself and your family. I am Dr. Mary McIntyre. I'm the Chief Medical Officer for the Alabama Department of Public Health. So at the end of this presentation, hopefully you will have answers to the following questions. What is the novel coronavirus? What are the symptoms of COVID-19, which is actually a disease caused by the virus? What do I do if I think I have COVID-19? What do I do if I have been around someone with COVID-19? Who is at the highest risk? And how do I protect myself, my family, and others? So what is the novel coronavirus? The novel simply means new. And while there have been a number of other coronaviruses that have been introduced over the years, many of them or several of them that cause the common cold, the term novel means new, which means that this virus is not only new, but it is much more from the standpoint of causing serious health effects, an issue. It is highly contagious. It spreads from person to person, which is what really makes it a real problem, and it does so at a higher rate than does influenza. When it first came out, people were saying influenza on steroids, but it's proven to be really bad. So in less than a year, it has infected millions of people worldwide. We first really learned about this, or China did, in late December. In the U.S., information early January. And since then, as of today, which is July the 20th, worldwide there have been 14.5 million cases of this new or novel coronavirus, COVID-19, that's been confirmed. Over 606,000 people have died worldwide from this virus. And in the U.S. alone, as of today, July 2020, we've got 3.83 million Americans and 143,000 deaths. This is extremely significant. In Alabama alone, as of today, 67,711 confirmed and another 1,180 probables. All of these are counted as cases, and more than 1,200 deaths. So this is why this is important for us to provide this update, because there are things that we can do that will actually help us protect ourselves, our families, and our friends. So what are the symptoms of COVID-19 infection? COVID-19 typically causes, in probably 80% of people or more, mild respiratory illnesses. There are also a number of folks that never develop symptoms. These folks we call asymptomatic. And you can actually spread this infection whether you're asymptomatic or pre-symptomatic. People who actually have the infection but may not be having the symptoms yet can actually infect other people. And I will go into the reasons why the face coverings work based on this. It is the fact that we do not know we're infected, and we may be out among friends and others that can lead to the increased spreading of this disease. So what are the symptoms? Fever, cough, shortness of breath, chills, muscle aches, sore throat, loss of sense of taste or smell, changes in sense of taste and smell, nausea, vomiting, diarrhea, and CDC just added a couple of new ones, runny nose and congestion, and also extreme fatigue. So the reason why it is so important for us to take steps and take actions, I call them actions from the toolkit, is because up to 40% of people may have no symptoms at all. This is information that's just been reported by the CDC in the last month. Anywhere from the other information from literature, from scientists also confirm this same info. Who is at the highest risk? We were saying at one point 65 and older, but guess what? There is actually a curve that shows as people age, the actual risk gets higher. So it can start before age 65 as far as that risk factor. And the fact that underlying medical problems are also present increases the risk of the complications even further. So we move, or CDC did, and we have to any reference to 65 or older because you can have a higher risk even before that. Sickle cell disease, BMI, obesity, which early on with a lot of the younger folks dying in their 30s and 40s, people kept saying, well, they don't have any risk factors. But the obesity itself proved to be a risk factor. So they could be healthy otherwise, but be obese and have an increased incidence of ending up on a ventilator or dead because of COVID-19. And also persons living in or working in crowded locations such as congregate living settings. And we know all too well what has happened with not only our older population, but persons within nursing homes and other congregate settings, whether you're talking about schools where they have children living together or jail situations. The Department of not just the Department of Justice has reported numbers associated with deaths associated with people that are in jails and prisons. There are other conditions that might increase the risk, and the reason for that is that the information is still coming out on how much higher the incidence of serious complications will be related to these. But we tell people that have asthma, especially lifelong asthma, that they need to take extra precautions. High blood pressure, cardiovascular disease such as stroke, and neurological conditions such as dementia are just examples. There are other conditions within those categories that cause, and you may have an increased risk. Now with pregnancy, early on, they did not think so, but we now have the information and the evidence to show that pregnant women who also have a reduced immune system during pregnancy and the changes and stuff from the hormones that create issues have actually been shown to have a higher number of those being actually hospitalized and ending up on the ventilator. The one good thing from this is the mortality rate, the death rate does not appear to be any higher, but they can die because they are in a higher risk category. So we need to keep those things in mind. And being on a ventilator and pregnant is not something we want to see women do, which means they need to be taking the extra precautions to do all of the things that we know that will keep you safe. So what do you do if you feel sick? I've already gone over the symptoms. You can have either one of the cough or the shortness of breath and really need to, with a new onset, request or go get tested. The other symptoms, we tell people to look for any two of those that I provided earlier on and make a call and stuff about getting tested. So when you actually have symptoms, we tell people to make a call. Do not show up at your healthcare provider or show up at the emergency room or an urgent care center, because what you do then is you spread the disease even further. More people end up being infected because folks are not aware that you potentially are. A person who has spent 15 minutes cumulative or more within 6 feet of a person with confirmed or suspected COVID-19 is considered to be a close contact. These are the people that must quarantine. Whether you get tested or not, whether you have symptoms or not, if you've had a known exposure, which meets this criteria, we call them 615ers, 6 feet, less than 6 feet within of a person for more than 15 minutes or at least 15 minutes. And this is cumulative. Let's say you did 5 minutes and then you need another 5 minutes later in the day. Well, if you got a total time with that exposure, it increases your risk of becoming infected, which means it increases your risk of being able to transmit this to someone else. Stay home for 14 days. And this is extremely important, that even if you're not symptomatic, you do not need to be out and about, because you could be infected and not know it, which is another reason for putting on a face covering, especially if you've been in a crowd and a group, because the risk of infecting others is not just protecting yourself, it's also protecting others. Why face coverings or masks? And this has become so politicized, and it's really all about the science. Despite what people tell you that there's no information and evidence, there is. And please don't rely on stuff from Facebook, Twitter, as far as being correct and accurate. I go to the source, which is the research institutions that actually have the data and the peer-reviewed clinical literature that shows me the facts. So opinions are just that, opinions. So how does it work? A face covering. It doesn't have to be an N95 mask, and in fact, we need those for our healthcare providers. But a face covering will keep some of the droplets and aerosol from escaping into the air. So we use the same factor when we talk to people about covering the cough, which is an extremely important respiratory hygiene practice, that this does even a better job than covering or doing your elbow and your to keep from getting the droplets and aerosol out. We're speaking about trapping those droplets. The other thing it does, let's say that there's somebody that's close by, they may have on a mask or not have on a mask. Not all of those droplets or aerosols are actually caught. Let's say they cough, let's say they sneeze with the mask on. So a few of them may still escape. If you have on a face covering, in addition to the other person having on a face covering, they trap some when they sneeze out. Yours prevents some from getting in for you to be able to breathe them in. So the combination together is what works. It reduces the spread of bacteria and viruses. Yes, we know that. We have the documentation that it works. And when combined with social distancing, hand washing, and sanitizing, you have another tool in your toolkit to reduce the infection or your risk of infection. Nothing is 100%, but I'd rather have 95% than 0% protection. So what else can I do? Limit where you go. Be extremely cautious about where you go. You need to make sure that when you're going into some place to eat, where you're actually potentially going into business to purchase an item, are people following the recommendations? Are they staying 6 feet apart? Are they using face coverings? Are they wearing the face coverings appropriately, which means that the nose and the mouth are both covered? If the mask is on, the nose is sticking out, guess what? You're still breathing out and breathing in droplets and aerosols that can cause infection. Stay out of groups. The best thing you can do is limit the number of people that you're in a group with. If you can avoid being in a group, regardless of whether it's 10 people, 5 people, try to do that. And limit who you allow into your home. I've said this and I'm saying it again, my home remains closed. The only people that come into my house, and I have lots of friends, and I have children and grandchildren, they still have to go through a screening process. I have to know before they even plan. They'll call, my son does, to bring my other granddaughter, and he'll say, "Mom, we don't have any symptoms. I've taken our temperature," but I have a thermometer right in the living room, sitting on one of the coffee tables, where, guess what? They have to get a temperature check before they come any further. And these are my children and my grandchildren. Practice social distancing at work and at home. It's not going to work if you do it at work and then on the weekends or at night when you get home or when you're out and about, you're not following social distancing. Your failure to do that will impact not only your ability to work, but also potentially whether or not your family and your friends become ill and sick. I certainly don't want to be the cause or the reason for anybody else getting this infection and ending up in the hospital. And I certainly would never forgive myself if I was the reason or the cause for somebody getting it and dying. So do all of the things that we've talked about and make sure that we're practicing and continue to do that. And most importantly, I tell people, clean, clean, clean. Hand sanitizers, keep them on the side of your purse if you're out and about, within your purse. Alcohol wipes, that anything that's 60% ethyl alcohol or higher works really, or isopropyl works really well with being able to sanitize and clean. I use stuff on my surfaces. My office, I have within there the Lysol cleaning wipes, because they do clean and kill the bacteria and the virus. I know that they're hard and difficult to find. What you have to do is, like I've started doing, any and every time I locate them, I order them, okay? Go online, also look at additional resources. The Lowe's and those locations a lot of times will send stuff out if you sign up for the blast. And even Sam sends notifications out at times to say we got so many. You just need to be the first ones to get them. And if nothing else, Clorox, making a solution. The information is available on the CDC's website. Get yourself a spray bottle, dilute it, and use it to spray and clean those sources that are non-porous. You can do that with any of your countertops to keep the bacteria and the virus infection down. So in closing, I want people to understand that nothing is 100%, but if you do absolutely nothing to protect yourselves, the risk of actually picking this virus up is extremely high. If you put all of the pieces together of the puzzle and in the toolkit, guess what? You have a pretty good chance of not getting this infection at all. I would rather have a 95% chance of not being infected than the potential of 100 because I'm doing absolutely nothing to protect myself and the people that I love. So stay updated. We have lots of information on the ADPH website that you can go to, social media, Twitter, Instagram, and YouTube. And I invite you to please go there. Thank you.